Welcome to COVID-19 Shelter Assignments. The coronavirus does not change the Red Cross mission. What is different is how we operate in the COVID environment. This training provides essential information to prepare you to be assigned to work at a disaster shelter during this pandemic. I want to reiterate and reassure you that safety is always our first priority. While some communities may have relaxed certain requirements, the Red Cross is following Centers for Disease Control guidance in an effort to ensure safety for you and our shelter residents. And we're going to spend some time now focusing on how we will practice safety in shelter operations. As always, but especially now, with the complications of the ongoing pandemic, as a disaster worker, your readiness, your training, your kindness, and a flexible attitude will be critical to the safety and effectiveness of the response. As you have learned in the Shelter Fundamentals course and your prior experience, sheltering can be a very complex disaster assignment. Since some shelter operations or operational roles may have additional tasks and responsibilities in the COVID environment, make sure that you get or give job orientations and know who to contact for assistance when needed. Make sure that you know your role and responsibilities and be ready to help out fellow teammates when needed. In the event that your shelter manager asks you to fill a position for which you have not been fully trained, you will be given instructions and there will be other teammates to lean on. And of course, you can always reach out to your supervisor. The Red Cross is working with partners to train additional shelter workers to support our shelter operations. In the COVID environment, all of us will always wear masks during our assignment and maintain social distancing. We realize it can be challenging to maintain physical distance of 6 feet from other people, as humanitarians and as operators, but the communities we serve and your Red Cross colleagues need us to model and maintain these important practices. One specific new role I want to call your attention to is the health screener. Anyone who's assigned to a congregate shelter may be requested to serve as a health screener in the designated screening area. Thus, everyone must be prepared to be a screener. In this role, you'll be provided additional protective equipment to wear, besides just a face mask. More to come on how to do this role of health screener later in the presentation. In advance of a hurricane or wildland fires, Red Cross supports and manages evacuation shelters, which by their very nature are quickly opened, may be bare bones, and are simply intended to provide a safe refuge to ride out the arrival of a hurricane or wildland fire. There's always the possibility that due to resource constraints, you'll be working with a smaller or less experienced Red Cross shelter team. And even with a full shelter team, you may find yourself working at a site with a high client-to-worker ratio. Once the evacuation phase has ended, most clients will return home, and depending on the disaster impact, Red Cross will then establish post-disaster impact shelters for those who have been displaced. It should be anticipated that some evacuation shelters may be under-resourced, as an example, limited personal protective equipment or hand soap, or perhaps no cell phone reception, for a period of time, which could even last through the entire evacuation period. Depending on prevailing situations, there may be significant changes to operational procedures in order to ensure the health and safety of our clients and workforce. COVID-19 conditions, the disaster type, perhaps civil unrest and other issues may shape the way we respond. Red Cross responders need to be sensitive and flexible to changing situations, while expecting the best support possible from leadership. On occasion, Red Cross workers may be assigned to support shelters managed by our partners. You will still have a Red Cross team leader as your supervisor, and the Red Cross fundamental principles will be followed, but standard procedures may be slightly different. You will be expected to work the times and locations that are assigned by the disaster relief operation. Shifts at shelters are generally 12 hours long, though there will be time for meals and breaks. The method of travel to the disaster assignment will be in the safest transportation available. This may be in a rental vehicle as opposed to by airplane. You are encouraged to take time now to prepare your own go bag that contains personal items that you would want on hand in the event there's a disruption in your travels to the disaster site or other issues that unexpectedly arise due to the disaster. Depending on the nature of the disaster and available resources, you may be lodged in a hotel, a staff shelter, or potentially staying at the evacuation shelter during the disaster impact for a short period. It's quite possible that your supervisor may ask you to take a short, just-in-time training, similar in format to this one perhaps, on a specific activity before or during your assignment. I want to emphasize that it's really important to spend time reviewing all of the guidance on sheltering in a COVID-19 environment prior to your deployment. It will help you to anticipate and meet sheltering challenges that you may not have faced before. Contact your supervisor now if you need help accessing this information. The Red Cross will do everything it can to make the shelter as safe an environment as possible for everyone. You can play a role in this by following the precautions that the Red Cross and the CDC have in place. Your safety is important, which is why we will ask you to monitor your health each day. And if you become sick, our staff wellness team will support you and determine the appropriate actions to be taken, which may include being isolated from others. During your sheltering assignment, you will be assisting individuals and families who prior to the disaster may have lost jobs, are out of money or are food insecure, have family members with COVID, or were suffering in other ways before the disaster. And because of COVID-19, our clients may act and react differently in a congregate shelter, such as choosing to sleep in their car outside of the shelter, or perhaps frequent comings and goings. Just remember that you are there to help those in need. Quite possibly, you'll be confronted with people experiencing extreme stress and are challenging to provide help to because of their behavior or emotional state. Ask questions to find out what their needs really are. As an example, they may refuse to wear a mask or expect to be helped before somebody else, or appear to pose a risk to the safety of others. As a shelter worker, we rely on you and count on you, your team, and the shelter manager to determine the best possible solutions in line with our fundamental principles. Through it all, and in spite of it all, remember, the client comes first. It's important to have a strong support system that you can call on during and after your deployment, whether it be family, friends, or fellow Red Crossers. We all need someone to lean on, and you can be there for others too. Your interest, dedication, readiness, passion, and humanitarianism is vital to the capability of the Red Cross and its mission. Please be safe, be a role model to others, and thank you for being a shelter worker. Now we're going to review how to safely do screening, why it is so important, and the steps we take to reduce the risk of transmission. In the COVID environment, the screening area is a critical aspect of a congregate shelter. Anyone who accepts a sheltering assignment must understand that they may be requested to support the activities in the screening area. We're going to review and discuss the screening area environment, how to safely wear personal protective equipment, and the screening process. As a reminder, we screen everyone who arrives at a congregate shelter before they go to the dormitory or would be directed to the isolation care area. That includes clients, shelter workers, and any visitors. All of these details are described in the COVID-19 shelter health screening using personal protective equipment job tool. Ideally, screening will be done by public health or a partner agency, but there will certainly be times where Red Cross will conduct it. Either way, Red Cross is likely setting up the screening area at the shelter. When we operate the screening area, there will be 2 Red Cross workers assigned, and more if there is additional complexity. Post signage alerting clients that they must be screened and the direction to the screening area. Communicate to clients that health screening will take place in this area. Some clients may have function and access needs, or other individual needs. Advise clients that family units and individuals will stay 6 feet apart and that markings are on the ground to assist maintaining proper distance. Red Cross is screening everyone in an effort to establish and maintain a safe environment. At all times, we will maintain 6 feet distance from all clients and other workers in the screening area and throughout the shelter. There should be a dedicated location near the screening area where screeners put on, take off, store, and dispose of personal protective equipment. The 4 types of PPE a screener will wear is the N95 mask, which is a respirator and different from a cloth face covering or surgical mask, nitrile gloves, the gown, and eye protection, either goggles, a face shield, or even large glasses. Now let's look at how you put PPE on using a poster from the CDC. Before putting on any PPE, you must wash your hands with soap and water for at least 20 seconds. First, you put on a gown. It should fully cover your torso from neck to knees and your entire arms down to your wrists. Attach it in the back. Recognizing that we always wear an N95 respirator in the screening area, put the mask up to your face and the lower elastic band goes over your head and down to the back of your neck. Then the top elastic band goes over your head and around the top of the back of your head. As pictured, place your hands above the sides of your nose and press to ensure a proper seal. Air should not escape from around the mask when you exhale. Then place the goggles on over your eyes. When you remove the goggles, you will need to clean them with a sanitizer wipe and then place them in a clean bag, such as a Ziploc with your name on it, so that you can reuse them for your next shift. And finally, put both gloves on and pull them up to cover the edges of your sleeves of your gown. Now that we know how to safely put on PPE, it's vital that anyone doing the health screening is wearing it at all times. Clients should be welcomed into the screening area, and we always operate with the assumption that anyone may transmit the virus. Thus, we must maintain social distance and regularly clean and sanitize all surfaces. If throughout the process a client is coughing, sneezing, or complaining of upset stomach, direct the client to the isolation care area for further evaluation by a health professional. Here are the 3 questions that we will ask, and if the client answers yes to any question, they should be directed to the isolation care area. If they answer no to all of them, then we go to the next and final step. Do you or anyone in your household currently have a cough, fever, or any type of respiratory illness? Have you or anyone in your household been in close contact with anyone who has been confirmed as having COVID-19? And are you or anyone in your household a healthcare worker caring for a confirmed COVID-19 patient? If the client answers no to the 3 questions, then direct the client to take a temperature strip from the table, peel off the backing, and place it on their forehead for 15 seconds. If the temperature is 99.5 degrees Fahrenheit or higher, then the client should be directed to the isolation care area. Ultimately, all the clients will be screened, or your shift may end. When screening is complete, go to the PPE removal area. Use hand sanitizer on your gloves, and keeping your gloves on, remove your gown. Then put hand sanitizer again on your gloves and remove your eye protection. Now you can remove your gloves and use hand sanitizer on your hands. Exit the screening area while still wearing your N95 mask. Now you can remove your mask and dispose of it. Wash your hands thoroughly for a minimum of 20 seconds with soap and water. We have just reviewed the screening area environment, how to safely wear personal protective equipment, and the screening process. The screening process is straightforward. It does not require any specific skills other than what has been described. However, it is critical that we wear PPE safely and accurately assess the health of our clients. The Red Cross is using the same PPE that health professionals wear with COVID-19 patients in the hospital setting. We recognize that there may be people arriving who are asymptomatic, and that is why, when we are not in the screening area, we will always wear a surgical mask or cloth face covering and maintain social distance, while following CDC's recommendations at the entire shelter. Safety of our clients and our workforce is the top priority of the American Red Cross. Thank you for your time and attention on this video. We encourage you to visit the CDC webpage and see more detailed videos on how to put on and take off PPE.